Really excited to be having hopefully a very fresh, forward-looking, smart look at how our social networks interact with our health. Obviously, the two are very connected. Earlier today, Grant brought up the point that health is this very inherently social thing. So really excited to have three fascinating entrepreneurs who've worked in this space before. I'll just give a quick introduction for each of them. So over here we have Jeff Arnold. He is the founder, chairman, and CEO of ShareCare, which is a health and wellness engagement platform. He has a track record of entrepreneurial success. At the tender age of 28, he founded WebMD. He has other ventures as well, including HowStuffWorks.com, the Curiosity Project, and the website for the Clinton Presidential Center. He's been honored by the World Economic Forum and Technology Hall of Fame of Georgia, and Ernst & Young named him Entrepreneur of the Year of the Southeast region. Next to him, we have Poonacha Machaiah, who is the co-founder with Deepak Chopra of Body, Mind, and .me, which is a social platform aimed at transforming personal and societal wellness. It'll be launched later this year. He's a serial entrepreneur. He founded something called Above, which is a bunch of versatile entrepreneurs. He co-founded the social enterprise called Weight Less Project, and he was instrumental in founding a social media startup in India called Kyuki, where he served as CEO. And finally, we have Grant Verstandig, who is the founder of Rally Health, which is a digital health company specializing in creating a more social, personalized health experience for every consumer. He founded it in 2010 at the even more tender age of 21 under the name Audax, and the company has since grown exponentially and raised over $55 million prior to his 2014 acquisition by Optum. And it's been named one of CNBC's most disruptive companies. So I had the opportunity we all caught up before briefly, and they are all just have so many different insights on how we can leverage our social networks to enhance our personal health and enhance society's well-being. So I wanted to start off by asking all of you a question, which was this, all of you have worked to build up these social networks for health. What space do you think social networks play in our health that traditional healthcare may not be able to fill?
I think social networks inherently have the ability today to tell a story. I go back and said 90% of the time we're actually healthy, and 10% of the time we actually go see a doctor. But the 10% is what we kind of really pay for. How can we build a social network which can basically tell me the story of my day, the narrative, right from the time I was born till the day I die? How can a social network basically be, from my perspective, be very action-oriented, not just about aggregating friends, but really sharing information? Two, how do you make it perceptive? My day starts in the morning as being a father, then I go and be a CEO, then I'm a friend. Social networks have to evolve. And health also the same way. As the day progresses, networks can evolve. The third thing has to be very fractal. I think the social networks today are very, very one-dimensional. And health, I know personally from my own perspective, when my wife went through postpartum depression, I had to go back and figure out and get information. It wasn't the medical system. I couldn't do it because I was the reason why she went through that. And then, so I had to go back and I couldn't really help her out. Her friends couldn't help her out because we were the first people to have kids. Only thing which helped out was other pregnant mothers. So I started looking back and saying, how do we build a social network which is now transparent and then takes into consideration where we are in our point of life? So social networks have to be very contextual, not very static.
Absolutely. That's a great point. What about you, Jeff? What do you think in your work? What need do social networks fill?
So the way I got involved in this kind of recent social network is we had a little company called How Stuff Works, and we sold it to Discovery Channel. And I met Oprah and then Dr. Oz, and Dr. Oz said, if you could start WebMD over, how would you do it? And I went and I looked at these amazing social networks, Facebook and Twitter and Tumblr and Pinterest, and said, wow, there's all this great engagement here. And for the first time, there's kind of one spot that can help kind of organize your interest, organize your conversations. But as it relates to health and wellness, it really wasn't made for patient to provider collaboration for security reasons, privacy, et cetera. and thought, wouldn't it be great if you could build a social network that had kind of three legs to the stool? One leg would be invest in technologies that are social, that are mobile, that are local. One leg would be investing in partnerships. So how could you take all these trusted health and wellness brands that haven't had a lot of digital impact and get them to work together so that kind of all boats could rise with the tide? And then thirdly, how could you build a leg that inspired digital caregiving? So instead of there being a WebMD, you could turn every empowered consumer into being their own WebMD, or maybe even every physician into being their own WebMD. And so now, a lot of times when I think about that question, or we talk about social networks, it's not necessarily the role that the healthcare professional not playing in social media, but what are the kind of the tools and services that we can give providers to enable them to join the conversation?
Yeah, that's a great point. I mean, we often think of social networks as existing outside our formal healthcare, but in reality, we're all living these lives that are complex and composed of so many things. How can you actually bring them together? And that's great, and I think that Sarika is definitely doing that. What about you, Grant? What do you think, what need do social networks fill?
So I think at its core, social does two things very, very well. They create an infrastructure for change, and they create an infrastructure for empowerment. If you look at Facebook and Twitter, they literally were able to topple a government in Egypt, but we're saying social can't affect healthcare in the United States. And so when I look at social and the value that social can create, it's that you can empower people. The example you heard first was a fantastic one around postpartum depression. You can empower people to not feel alone. You can empower people to connect and change their behavior, to go from being sick or ill or in need to being healthy. And you said it well, but we always talk about it internally at our company. People don't want to be patients. It's the worst part of their day, worst part of their lives. They want to go back to being people. They want to go back to being individuals. And what better way to do that than have an infrastructure that's all around empowerment and change? And so if you can connect people to other people like me, to content, to personalization, to incentives, you can literally create a wealth of data at someone's fingertips. And that's all been created because of technology. So now you have something in your fingertips that can disseminate information across the globe in less than a second. And you have people that can create commonality. I mean, the latest statistics around Facebook where they have such a reach that within any person on Facebook is it within 4 to 5 degrees of separation to every other individual on the planet. So if you can put that into solving a problem around stress, or we talked about earlier, my knee problem and his knee problem, the power of data and social is just bringing data to the people and then allowing those people to affect change.
Yeah, I mean, that brings up this really interesting point about, social networks in general, what they do is they just completely democratize information. And I think in health for so long, we've had one locus of information, which has been the physician or the healthcare provider, and then just the recipient. And I think this whole idea of building social networks is putting those locus of information much more, to be much more disparate around the universe. So how do you think that works in health particularly? Like, what power does that have?
Yeah, I mean, we were talking about earlier, social in and of itself is, health is actually the best example. We're talking about it with, if you think about what health is today, forget technology, take it completely offline. Health is one of the most social things we do. When you're not feeling well, you talk to other people. There's a thing called a referral that in and of its nature is social. And so we did this study internally around what people shared online versus what they shared in person. And people share exponentially more information when they're sitting down and having a conversation with someone, even if it's a stranger. So health is extremely social. We're asking for information. We're looking for advice. We're saying, which doctor did you see? How did your knee do? What rehab did you do? But then you go online and people get very scared because now they're actually typing something. It's sort of like when you write an email that you're really upset about. You're not supposed to press send. You read it first. And the problem with sort of healthcare, as Jeff indicated, was there's a privacy and security infrastructure that now you see all that in one place. You have to sort of overcome that fear, but yet you're doing it anyway. You're having these conversations with basically complete strangers all the time. I've never met him, and we talked about knee problems, and he knows more about me than one of my doctors, I'm sure. And so we're doing it all the time, and I think social, as it now with technology changing around security and privacy, as long as it's permission-based, so as long as I can control who I share what with, I think that's where you'll see an incredible impact and change. So if I know that I'm sharing this with my mom versus my doctor versus my best friend versus you, if I can control that dissemination of information, that's unbelievably empowering. It's when you have sort of the Facebook effect where I didn't realize I posted that online, where you'll see a collapse of, I think, the infrastructure around social.
So this point that you bring up, and I think that when I first was asked to be on this panel about social networks and health, the first instinct that I had was, how do you build in trust, and how do you build in that sense of integrity, and making sure that people feel comfortable to be able to do this? How have all of you started to address that?
I think, in consumer-driven healthcare, patient engagement is really important, but so is trust and privacy. And you have to put that in the hands of the consumer, and if you lose that trust, then they don't engage with you anymore. The question of kind of the internet, the power of internet and social networks, what's great about the internet is you can take all these fragmented technologies and you can start to put them in the cloud in one stack. So whether it's a health risk assessment or clinical decision support or online scheduling or connected devices and wearables or personal health records, it now sits in one spot, which is interesting. But then when you combine the power of social, it gets even more interesting. So we built a social network for the Army called Army Fit. And it took all those fragmented services and put it together. And what we found is that people used to average 1 minute when the site wasn't social. Same services, but non-social, to now averaging 23 minutes per visit. They used to come once a year, and now 2/3 come every 3 days. And it's because all of a sudden they're now being able to share a lot of the things that they're participating in, whether it's trying to improve their real age score or whether it's trying to lose 10 pounds. So I think that traditional healthcare system that had all these floors in the skyscraper that were all these one-offs, when you put it together in a social network and allow people to share that with their friends and colleagues, you kind of get this, kind of explosive effect that I think is going to be able to improve not only quality of care, but get us faster to better outcomes.
But how do you build it? I'm just wondering how also you build that sense of trust in the first place that gives people the permission to use that space to talk about their health problems. And, I mean, I know you, Poonacha, that you've worked on mental health in India, and I've reported on mental health in India before, and I know that it's very deeply stigmatized. How do you get people to actually be social about this?
I'll give you an example, right? I believe that today we are at a time when we're growing a lack of intimacy. We are completely a world which has kind of gone social media, and our relationships start online and end online, right? Today, when actually I'm writing a paper on intimacy and internet, basically a guy and a girl meet online. And today for my 13 or 14 to 14-year-old, he doesn't really want to meet offline, right? So today what happens when you meet online and boy and girl are chatting on the internet and the girl decides to block you, your body goes into a stressor and your sympathetic nervous system fired. We are 1.2 billion years of evolution. We have 20 years of internet chat, right? So our body is like, and Robert Sapolsky had an article called Why Zebras Don't Get Ulcers. Technically we don't know. We stress about everything. My flight not landing because of wind. My mic probably going to fall off right now. There's also going to be stressors, right? The moment I realized when we can actually intercept this and provide correction on the spot. So when we start writing an algorithm now to go back and really analyze people and their online relationships. Today I can go look at your Facebook pictures, your posts, if you're wearing a wearable, your heart rate, blood pressure, your skin conductance, and the way you walk. And basically we have taken what a psychiatrist and a therapist does in a 1-hour session online. And now I can go back and say, what, have you called Poonacha lately? Instead of sending your friend a poke or tell them to connect, send a message to your friend to the network and say, what, call Poonacha. His mood, have you contacted him? When we do intervention in real time, we build value, we build trust. If there's no value, there's no trust, right? So I believe inherently social networks have to provide value. And if a network gives you value, you will trust to share, right? And that's what the 13-year-old does. They don't care about privacy. They care more about remixing and sharing.
That's I was going to pile on. I think we look at trust all the time, and I think there's 2 core pillars or foundational elements to trust. It's value and transparency. And what healthcare's done a traditionally poor job of is being transparent. So where's this data go? How's it being shared? I have to go to the doctor and fill the same form out every single time, and literally nobody knows what it's for. They just go and they fill it out. And every single time, it creates this infrastructure where you're constantly giving data, you're not getting anything back, and you have no idea where it's going. And so if you can create a model where trust is sort of this one pillar, and then you're constantly building value. So all the time in healthcare, Jeff made the comment about health risk assessments. That's my favorite analogy. So answer 55 questions if you're in this fully insured client, Fortune 500 company. Not going to tell you why. You get nothing for it. And just answer them, and if you don't do it later, I'll give you an incentive so you do it. There's no value in that. So if you started saying, hey, answer these questions, here's what it's for, here's why we're doing it, and I'll give you an incentive to do it, you see the participation rates double or triple. And that's about just being transparent, showing the value, and showing where the data goes, and then consumers will make the decision saying, hey, if I answer these questions, and you're telling me this will go back to help lower my costs, and I get an incentive for doing this, and you'll help me find the right doctor. People do it. We see with our product a 97% completion rate, but we've changed the model. We haven't changed the questions. We just changed the model around how we present that value and that trust and that transparency to the user.
Yeah. So one other question with trust that I started thinking about last night was that there are a lot of people who are looking to benefit from this type of consumer data besides just, a doctor who may be looking to help actually cure you. There's a lot of pharmaceutical interests, a lot of medical devices that are looking to be sold and are looking to pop up as advertisements whenever you're Googling anything. How do you build trust that, your data is actually going to be safe, especially with online social networks? You brought up the point before that people are so much more comfortable sharing things in person rather than online.
Yeah, well, I think, historically, a lot of the efforts in kind of health and wellness using digital health had to be funded by the pharmaceutical industry and others because this stuff's real expensive. It's hard to get people to come to your website and get them to do what you want to do. So drug companies would help fund that for being able to drive impressions during that experience. I think we're seeing kind of a big shift now in digital health, where all of a sudden now it's about population health management. And that you look at the military, the example I used, they spend $58 billion a year on healthcare for 9.7 million people. It's 10% of the entire DoD budget. And so all of a sudden we found new pharmaceutical companies that said instead of trying to push pills to patients, what we're going to try to do is use these digital tools to create outcomes, and those outcomes will create cost savings, and that can fund a lot of these efforts.
Wow.
I also think social networks are inherently very intelligent, right? So if there is a brand which is being exploiting it, the network will revolt. It's almost a self-built homeostasis of social networks. So I believe, and I fundamentally believe today, Lady Gaga's, I don't remember last time when she sang a song, but her brand is pretty big, right? So if the same brand comes onto a social network, or any social network, and does something not aligned, the moment they start spamming me, I as a user will actually revolt. And overnight, the network effect will take into effect, and the brand will lose credibility. So I always believe if you can build inherent trust, transparency, and virality, network will take homeostasis. It is a self-healing network.
Yeah, I couldn't agree more. I think that's one of the biggest problems in healthcare is people wait for perfection. And we saw this with our product. We have a very large social component, and it's completely open. You can say whatever you want on this product. And a lot of the people that are in healthcare, particularly in the medical field, say you can't. What if someone comes in and says, eat this root and it'll cure your cancer? And we give the exact same answer, because if someone says that, everybody else will say you're an idiot. Or someone come in and say, hey, here's the clinical relevant perspective, and here's the one that's not clinically relevant. And it all polices itself like that. And so we're always waiting for something to be perfect or be clinically proven, and we need 7 years of trials. And the reality is, the homeostasis of a social network, there is not a faster real-time feedback loop in the world. You can put something out to 1 million people on Facebook, and like this, they'll either like it, or they will spam the hell out of it and try to tear it down. They literally, I used the same example, like the Arab Spring. You saw an entire country come around one single experience in a 7-day period. It's unbelievable. You couldn't do that with anything else in the world. The amount of people they had starting on the internet and then moving to physical, squares and these types of things, it's unbelievable. And we actually in healthcare don't utilize that network effect because we're always waiting for some, longer, elaborate trial, and we can't do it because we're afraid of failure, and that's what holds us back.
There's still risks, though. I gave this example earlier to all of you about the anti-vaccination movement. I think that was born from Twitter and really gained popularity there as well. So, I don't know if there's a way to guard against that coming in the future, but I guess that they have, faced a lot of backlash as well, as you were talking about.
I think the moment the influenza vaccine, like somebody was talking about, is implemented, and it's actually making change, I believe in data I trust. When you give data, 20 years ago, when I was talking to Deepak, people said yoga, meditation, mindfulness is good for you. People thought you were either in Aspen or in Sedona, right? And now when you go back and it's a woo-woo Eastern thing, right? Eastern tradition. Today there are studies, there's telomeres being extended, right? And there's data, which is basically showing that this is good for you. The data now takes over the noise in the system. So being an engineer at heart, I always said, anybody throws me a problem, I will come back with data. And if I come back with data, the data will do the talking. So I think I go back even to the anti-vaxxers. The moment you show that vaccination outweighs the benefits and there's data to prove it, the noise will get dwindled down.
Can I ask you a question on that? If you were trying to build an algorithm for health, and you said the algorithm is data plus knowledge equals engagement.
Right.
And you were trying to apply that to stress and anxiety. How would you think of that from everything from the devices you're wearing to selfies? How do those three thread together?
In fact, the four things we look at is basically exercise, nutrition, sleep, and stress. I think if we do these four things and manage it, because lack of sleep is hormonal imbalance, because stress is hormonal imbalance, and then you counteract with, I think these four pillars, if we can actually instrument it in our social network, come up with an algorithm which allows people to kind of manage it, right? It's a reality, I fly from India to here, I fly over 22 hours, I am going to be sleep deprived. The question then comes down to what are you going to do about it? Behavioral change, right? Behavior only happens when there is a cue, right? It's like brushing your teeth. Only when you have the cotton feeling in the mouth in the morning is I got to brush my teeth. The reward is nice teeth. What is the craving? It's the tingling sensation when you use toothpaste, right? The toothpaste, you got nothing. The tingling sensation is just mint. It doesn't really add any value. So the cue reward habit cycle is what social networks need to create, right? Which is what's missing today. It's all just aggregating, giving data, it's one-sided, but I really don't see how it's changing my life dramatically, right?
And do you see wearables as kind of the next wave of that if you can't apply that context?
Yeah, I think I look at hypermobile. I look at today that wearables are going to be pervasive. 1,000 sensors around us as we speak, right? So if I go back today and I look at it, people have watched the movie Her. Yeah, it's fantastic. But there's a Her equivalent in medicine, right? If I come back today and says, Poonacha, you slept for 5 hours, and here are the 4 reasons. You took a flight from India, which it knows today because of lat long. It knows I had 5 cups of coffee because I typically have 3. It knows I went to Starbucks. It also knows that every time I call this person before I go to bed, maybe somebody, it says you don't sleep well. People have a very big relationship in how our body reacts, people, right? The last one could be like, when the pressure and air quality and temperature changes, which is air quality, particulate matter affects your health. Imagine a world when we can actually correlate all that in near real time and predict, right? This is what happened, right? I'm driving on Highway 1 in Pescadero, picked up a nice car, and all of a sudden my heart rate has gone 120 beats per minute, baseline is 60, and it just pings you and says, you know what, Poonacha, pull over. Just breathe for 30 seconds. Breathing we can do anytime, anywhere. And here's how we can breathe, a small breathing technique. We are not too far away. I think technology is already there.
Well, look at, while this was going on, Google had their big developer conference, and they announced all their numbers for Android. So they have 1 billion users a month on Android. The average person who has an Android phone looks at their phone 123 times a day. So imagine if you had some type of feedback loop for healthcare. It's already there. You're already glued to your screen. You're looking at this product every day. But if you can close that feedback loop and you're not allowed to check your email now, and you can tie to.
Now, what I was actually showing is that it's actually here. Right?
Exactly.
I'm actually streaming my entire body parameters right now in real time, and it can actually now the analytics running in the back to give me my moments of anxiety and my moments of bliss. Because today, when you go back and you ask people what made you happy, and the number one question I started saying, when I came to Aspen, or when I went on vacation, happens 3 or 4 times a year. But just talking here could be my bliss moment. If I knew what gave me bliss, hugging somebody, a call with somebody, reading a book, happens every day, right? If I can tell people, being aware, what made you happy, what was your bliss moment, when your heart rate variability was low, when your skin temperature was low, it was an aha moment. People don't know, we're not aware. That's when wearables come into play.
What both of you are saying brings me to this idea that I've heard many times over. I've been trying. I work with a nonprofit called the Solutions Journalism Network, and we've been working to build up a network among journalists. And a piece of advice that I've heard constantly is, meet people where they are. Really, go to the devices that they're already on 123 times a day, which is kind of sad. And go to the platforms that they're already using and build up from there. Have you seen that apply in your own work at Raleigh?
Spot on. I think actually Jeff said it really well. Healthcare prior to that wave of thinking was a skyscraper with every single floor had every single different fragment or product. And so if you can meet people on their phone where they already are doing something 123 times a day, introduce some type of value, some type of incentive, some type of engagement, people will do it. Nobody wants to be a patient. And so it's like, why do people check their phone 123 times a day? Because you've got apps, you've got Twitter, you've got your friends, you've got text, you've got Facebook. Why can't one of those things be, hey, your heart rate went down and you found a great rhythm in what you're doing? Repeat that and you can lower your risk of heart disease. Because in healthcare, if you don't meet people, so right now healthcare doesn't really meet people where they are. And they don't do that because, use your analogy about brushing your teeth. you don't see the benefit or detriment of brushing your teeth for like 20 years. So if you don't brush your teeth every day for 20 years, you'll have bad teeth, you'll have risk of heart disease and gum disease, all these things. But it's a broken feedback loop, right? Everything is 123 times is like this. So if you can take that data and meet somebody where they already are sitting and tie those behavioral cues, like brushing your teeth, like checking into a goal that shows how many miles you walked a day if you're overweight, you can just change the world just by doing that.
Yeah, and I think decision support, because I think health and wellness is a little more complicated than some of the other areas. But how do you start to use decision support to marry people with trusted advisors? So imagine kind of in healthcare a Watson consumer where you have this decision support platform where you open up your iPhone, you've got abdominal pain to Siri or to her, and it gives you a smart questionnaire that's all cited from medical literature that then yields you a diagnosis, and that's your Watson component. And then you click a button and Uber pops in and says, based on your health insurance plan, here are providers in your area. I can send you to a Minute Clinic. I can let you book a doctor's appointment. I can let you FaceTime with a provider if you need to go to the ER right away. And all those recommendations in that decision support is also trying to match you up, maybe even with somebody just like yourself with a trusted advisor. Because there's just so much content now on the web, there's just so many choices. How do we start to hook up the right people with journalists like yourself as you build up those networks?
I mean, the interesting thing about that is also that you're using the online platform to quickly get people offline and actually having conversations where there is a little bit, there is more trust. How else do you think, how do we actually manage these offline relationships and get them to actually happen more often?
I think I have a very simple outlook to life. I always say, tell me something about me and tell me who's like me. Right? If I can find somebody like me in my local city, if right now I find the algorithm said there Poonacha 10 people like you, and by the way they're in this room right now, meet up. Right? The biggest problem when it comes to offline behavior is time. Time is a constraint. But if you can find a way to manage time through behavioral interventions, you can make a lot of meetups happen. Meetups are happening today anyway. When I was in the volunteer fire department, bingo nights happen all the time. There are systems which are there. The question is that when you move, can you connect you into that local meetup, right? And that's the biggest problem. I'm here in Aspen, I don't know exactly where I fit in, right? If I can now find an algorithm to say, Poonacha, here are the 5 places where this local group syncs with you. You will go meet, right? And that's where the online, offline probably will happen.
Absolutely. Hopefully after this session, all of us, all seem to be somewhat like-minded. We can all connect. Grant, I think I wanted to switch gears a little bit. I find it so fascinating that you mentioned in an email that 80% of the people who work with you are not from the healthcare industry. How does this work? Was this a conscious decision?
Yeah, it actually was one of the few conscious decisions that worked out. When I went in, so I started the company because of my own experiences with health. And the thing that's funny about healthcare is all the data exists. We talked about it earlier. I think in healthcare today, insurance companies, providers, they're all bastardized as being these horrible people. But every one of those people, particularly physicians, get into health for missionary reasons. They want to make a difference. They want to change. And I spent a lot of time looking at, okay, you have all these people that are willing to make change and engage in healthcare and make a difference in people's lives. You have all this data, and there's this massive transom in between. And the consumers, going up the escalator in that skyscraper analogy by product, by product, by product, by product. And I just said, where has it worked? And so I looked at all the companies. A lot of our employees are from Facebook. A lot of them are from Zynga. A lot of them are from Twitter. A lot of them are from Adobe, saying, okay, you guys have gotten to an unbelievable amount of scale. And you have certain things within, let's use Zynga as a great example. You got people to spend $1 billion a year on virtual farm equipment. It's unbelievably engaging. And so what we said was, if you can get someone to spend $1 billion a year on pink tractors that has literally no real-time value or real intrinsic or extrinsic value, what if you actually had a health event that was actually valuable and you could use those same principles around engagement, currency, gamification, competition, social? So one of the things hugely powerful is it's really easy to let yourself down. It's very hard to let your friends down. So if you can use that same infrastructure saying, hey, Jeff's crushing you in a goal to lose 10 pounds, you see an unbelievably high uptick in engagement. So I wanted to hire people that had figured those things out outside of healthcare, because we already know the problems we have to solve inside of healthcare. And we wanted to be We wanted to focus on the user experience and the design of the product, and then go backwards into solving the problems, because the problems are lower cost, people don't engage, they engage when it's too late, nobody wants to be a patient. So those are all well understood. The problem is, how do you get them to affect change? The only way you can affect change is capture audience, and that's what Zynga's done really well, Facebook's done really well. You just heard Google's got 1 billion users a day, going 123 times per day. What if you had someone in healthcare that checked their healthcare statistics 123 times a day? You'd get rid of the obesity epidemic like that.
Yeah.
And so that's how we thought about it.
Jeff, I know you've also talked about gamification, right? Have you built that into your platform as well?
Yeah, so I think Grant's kind of spot on. Is when we started building ShareCare out, we said, well, ultimately the goal is we want people to achieve optimal health. And when you start to look into healthcare to get inspired, to have somebody reach their human potential, you don't find a lot of health information technology companies that give you that same vibe that like an Apple gives you, or a Just Do It gives you, or Be All You Can Be gives you. But I think the concept of human potential in healthcare is a big one. So we looked at it and said, we need to get inspired, and we need to figure out how to build a health profile for the consumer. And then when you start thinking about profiles, we say, well, who's done it well outside of health? Amazon comes to mind really quick, right? They've gotten so good at predictive analytics. They're shipping stuff to your back door before you even know you want to buy it yet. And we said, we should build that health profile out. But in healthcare, one size doesn't fit all. So you have to have lots of choices, right? Back to next generation health risk assessments and clinical decision supports and wearables and all that good stuff. But you need to let the consumer pick what's going to sit inside of their profile. And then ultimately, you need to connect that back into the healthcare system, because those two need to work together. And I think it can't get lost in this conversation of the importance of that. And so, you can't force it. There has to be a meaningful role and meaningful communications that helps add amplification to that health profile. And you start kind of going through the buckets, and you say, well, there could be administrative impact, right? I'd rather do an open table appointment with my doctor than call them up on the phone. And then you just fast forward to stuff, and soon you're talking about FaceTiming with your doctor, you're talking about spiritual health, you're talking about brain fitness, and what sits at the core of all that activity, which has never happened before in healthcare, is the consumers making those choices. And technology is all here now. I mean, you talk about the Internet of Things. In 2009, 50 billion devices were connected to the Internet. Oh, no, I'm sorry. In 2009 was the first time that the number of devices connected to the Internet surpassed the number of people on the planet. It'll be 50 billion devices by 2020. And so you say, well, how does the Internet of Things work today as we're all sitting around wearing Fitbits and we have our iPhones? Well, pretty soon here, your phone's going to wake up and it's going to say, I see you're in Aspen, Colorado, and it's 80 and sunny outside. I've looked at your calendar, and the first presentation you're going to is at 10 o'clock. I've gone into your Runkeeper account, and I've mapped you a 3-mile run around your hotel. As you start to run or hike, I'm going to play you music from your iTunes account in which you get your best time. And when you finish it, I'm going to give you a 2-day micropayment on your real age. And that's the Internet of Things, and that's all here now. And it's just a matter of how you apply those APIs so that that example that I just gave is meaningful to you. And all of us will have different examples of what we care about.
One final question before we turn it to the audience. I'm sure all of you have a lot to add to this discussion. Everything that we've all been talking about is obviously serving a certain demographic. People who can afford to have a Fitbit and iPad and all of this. How can social networks be leveraged for people who are less well-resourced, either both domestically and around the world?
I think everything which I've done, I've kind of looked at the smartphone being pervasive. Everything I've done, at least in India, using the smartphone, it's pretty much ubiquitous right now. And looking at the roadmap of Apple and the Samsungs, everything's going to go into your phone. Your heart rate monitor, your pulse volume, how do you manage it, stress and everything, your voice modulation, everything can be done on the phone. So the phone is going to become pretty ubiquitous. Second thing, I think from my perspective, people will adopt any technology if it tells a story, right? For me, when I started looking at adoption of technology, even in parts like India, the reason I worked with a filmmaker before my previous startup was to look at how do you tell a story of health. I want to go back when I'm 85 years old to say I've led a reckless life, but I loved it, right? I jumped off a plane when I was 18, I was a skydiver, I have compressed spinal compression, but I want to be able to show my child and my son this really fantastic story of motorcycle riding in the Himalayas crashing, right? And then this is my story of my life. Health has to be love, right? People today, when you go to a healthcare platform or solution, I don't love it. right? It has to transform into love. So when you bring that paradigm into adoption of technology, it will work. Even in the most, I would say, native, economies which are just starting off, mobile phone is ubiquitous. You can tell good stories, healthcare stories with a mobile phone.
Yeah, I mean, it's Moore's law, right? I mean, some of the incredible side-by-side comparisons are the cost and size of a chip in 1999 and the cost and size of a chip 100 times its size in 2009. And so as that technology curve goes like this, in terms of cost and quality goes like this, you'll have an iPhone of 2008 that, yes, it's not $1,000, maybe it's $100, and someone in India can have that product because technology is becoming so ubiquitous and it's constantly iterating and growing. And I couldn't agree more. I mean, it's becoming a hub. And you look at, Africa's a great example. Even just a text message. You don't need a smartphone. You don't need mobile web. You don't need Siri. But if you can send somebody a text message to remind them that a malaria treatment is a three-course drug, not just one, you can cut down on the readmittance of malaria-related illnesses in hospitals by a huge factor. You just need a text message just to remind somebody. So I think technology plays a huge role because the cost of technology is becoming so much more accessible while the quality and the products are becoming more ubiquitous. And I think health is going to play a huge part of that.
Yeah, I think these guys are spot on, is that the phone's going to be the greatest healing device we've ever seen. As it relates to underserved populations, you're starting to see a lot of game theory people come into healthcare, which is really interesting. So as you look at what Samsung's doing and Apple's doing and what Google announced today, what game theorist people would say is if you want to get somebody to do something, reward them with something they want. And so we've seen some examples in rural hospitals where they give underserved populations more minutes on their prepaid phones to encourage a certain behavior, to in the millennials using music as basically as a reward to do certain behaviors. So I think that's very exciting about healthcare. So when I see like the Googles and the Samsungs and all these guys coming into this space, I think it's great. We're all going to have connected devices. We're going to be able to put that into context. But you're seeing these game theorists come with it, and I think they're going to come up with some amazing ways to motivate people to change behaviors.
You know, one quick anecdote that I just thought about. This is apparently somewhere in Pakistan where this group of researchers wanted to make sure that patients with tuberculosis were complying and taking their drugs every day, even though they have some side effects, to avoid getting drug-resistant TB later on. And one way they started incentivizing people, similar to what you're talking about, was to give women these strips that they would pee on, because if you were taking drugs, then there would be a certain chemical in your urine. And if they did that, then a code would appear so they could get more minutes on their mobile phones.
Yeah.
So, which I thought was just such a fascinating way to get people towards a certain behavior.
But that's something really small, but what you guys are both saying is fascinating. It's actually a revolution in healthcare, because healthcare has been all about the stick. So if you don't lose weight, you will die. You don't lose weight, you'll have a heart disease, whatever it is. And now it's transitioning to be about the carrot and about improving, which is at its core, I think, a huge revolution. And so if you tell somebody, do a healthy behavior, I'll give you a reward, versus a finger wag, I think you'll see huge change.
Yeah, and you think about the carriers who are going to win here, going to win big here. As all this takes shape, they have a social responsibility, to give back, and it seems like minutes is a pretty logical one.
So I'd love to throw it open to the audience for a few minutes. A couple of quick reminders before we do that is, one, given the fact that this is a panel about social networks, and social networks thrive with many voices, you could keep your comments and questions rather on the short side, and also something that will make sure to move the conversation forward, that'd be great. Second reminder, if you can just make sure to wait for the microphones to come around. I promise they are coming. So let's start over there. Yeah.
Thanks. Yeah, my name's Dave Secunda. Clearly, children have a huge role kind of in preventative healthcare and engagement in social networks as well. And yet we have the Children Internet Protection Act, which creates a lot of limitations when kind of interacting with kids under 13. Although I believe that social networks could really influence behaviors at an early age that could make a long-term difference in health. Any thoughts or ideas on how to engage children in social networks in a changed format?
I'll give an example of what I did with my son. I have two boys, 13-year-old and 9-year-old. My 13-year-old is a national level golfer in India. My 9-year-old is the national level, I think, V and PSP gaming guy. Can't get him off the couch. So I gave him a Fitbit, and I basically told him, based on the number of steps you run, you get X amount of minutes of Angry Birds, or whatever game he was doing, right? So what I found him doing is constantly beating it. So now it saved two things. He was actually working out, getting the steps in. So it's actually coming back to game theory. I think there are a lot of apps which are being done for the internet. If you look at wearables, it's very contained. When I started working on technology, when you give them access to YouTube, YouTube can't control granular access, right? So you just have to change the paradigm. I think engage them in different ways. It's possible.
I just would say, since it's Aspen, you can be controversial. I think it's a horrible act in how it's been manifested, because you look at children with obesity and how that's growing, and they're forced to play. They can play Xbox, but they can't log on to my product. And I think that's ridiculous, because the country's so crippled by what might happen. And I think what you're saying is spot on. If you can create a role-based infrastructure, so at least mom knows or dad knows that you're coming onto a product and what you're doing and how you're sharing it. You know, we've had this on a TV. You can put a parental control that if it's above PG-13, you can't see it. Why can't you do that with a product? And so I think you're going to see a huge change, because Facebook has run into the same problem. I mean, they're literally out of users to add to their product. And so you're going to start to see a change, because what's happening is kids are going on the products anyway. They're really smart, and they find a way to get around it. So you'd rather meet them where they're going in this case than where they are, because where they are is they're going around, they're not getting off the couch, they're not getting the information they need, and they're playing Xbox, versus getting the information around, hey, if you get your Fitbit and walk, you should lose weight. And so I think you want to create an infrastructure that ties to those permissions, so you can say, hey, like you're doing, the two sons, you're going to compete, but he knows what they're doing at all times. You have to have that safety net, but it's a great question.
I think there's also some fun things you can do. 'Cause I know always when dealing with my kids, that's usually a prereq. But you know, so it starts off with the wearables, and you can compete as a family, and that's pretty neat. And then you start to look at things like health literacy, and you say, you know, health literacy in the U.S. is pretty low, and I see my kids playing Quiz Up, you know, all the time. I don't know if you're familiar with that app.
Great game.
And I'm like, you know, it's an amazing, you know, I can play anybody, anywhere in the world on any topic, and it's had a lot of success. And I'm like, boy, there should really be a strong healthcare focus on that. Then you look at Tinder, which is like this latest dating service app, which what you know shocks me about Tinder is they're getting 850 million swipes a day. And it's basically that person's good looking or not, you know, type technology, and it should be, should I eat this or that, you know, type technology. So I think there's a lot of fun stuff you could do with kids as well by looking outside of healthcare again and seeing, you know, what are they using, what are they engaging with, and how could you approach that with a healthcare lens.
How about you there in the purple?
Hi, I want to ask you a question about social communities. We're attacking digital health disruption from the discharge process in hospitals. And we feel like there's an excellent opportunity to enroll patients before they leave the hospital. So we risk stratify them, we make it digital and interactive, but we don't have a safe place to hand them off in the care transition process. You know, we can do great things with consulting on the post-acute partners that we're handing them off to and assessing them and auditing their abilities, but we can't do much with where we hand them off into the cyberspace, right? I've seen patients like me, I've seen Alliance. Yeah. Where would you hand off those patients to a safe environment for them to commune with people who have like issues?
I think when you talk about this, it's actually in between a social network and a private network, right? Like the private cloud and public cloud. Qualcomm's doing a bunch of interesting work in machine-to-machine ambulatory care, looking at sleep apnea monitoring, right? Also people, let's say they had ACL surgery, go back home, you got to keep constantly moving your leg. So they're looking at actually attaching a Fitbit and actually monitoring how you're moving. I think there is also now a role for a secondary network, which actually is in between social and hospital network, where you can safely hand them out, because you need to provide a quality of service, right? Without that, you cannot have, because the social networks to a large extent is best effort, right? But we're talking about people who need to be monitored, who are not in the hospital, but actually at home. I think there is a use case, and I'm just brainstorming here, for a secondary, tertiary network, which is in between social and the hospital.
Yeah, I think you're seeing a real explosion in that area right now, is that for the first time, patient engagement has made its way into the C-suites of hospitals. So they used to think if I'm going to spend $6 billion this year on electronic medical records. Problem is only 6% of consumers adopt those EMRs. And so they've realized that patient portal isn't going to drive engagement. So I have to go outside the EMR and start to drive patient engagement solutions. And so for us, for example, 10 big hospital systems have invested in ShareCare in the last 6 months. And that complements the Dr. Oz and the Oprahs and the Discoveries and the Sonys of the world. The reason they're important is I have to drive awareness to that consumer that this stuff's available to them. That's where they become important. But the true guys that you're talking about, the people at the point of care, it's hugely important that they embrace patient engagement strategies with a marketplace mentality so folks like yourself can plug in these very valuable services in an API and a comprehensive outlook to that consumer as they're walking out that door. But when we first started WebMD, 92% of doctors said they'd never use the internet or email to talk to a patient. That was a little over 10 years ago. Now all of a sudden, because of meaningful use and other things, hospitals have all woken up and said, you know what, patient engagement really matters. Consumer-driven healthcare really matters. I got to get behind products and services that you're offering and make sure those consumers use it because it's in my best interest because for the first time I'm taking on risk of this population.
Anyone else? See a hand over there.
Hi, thanks. My name's John Fox. It's kind of a follow-on to that in terms of the handoffs between this kind of, personalized, quantified self movement and then what's going on in hospitals. So right now, when patients can gather all this data and have Fitbits, the minute they enter into the hospital, they enter into this world of legacy software and closed systems that don't talk well and don't handle APIs well. How are you feeling? How are you finding the ability to sort of break through that? And where do you think that is going to go in the near future?
I would say carefully. I don't know. I think depending on geographies, I think obviously in the United States it's very, very regulated. I'm not very familiar. When I look at countries like India, I think any support, any care you can provide is much appreciated, right? All I can say is that the quantified self movement is now becoming quantified social. Because quantified self is very reductionist in its approach, just looking at my body. We actually body heals when you connect with other people. Already that movement is going social. As far as how hospitals are adopting it, I guess, Jeff, you're in a better position.
I think that the big breakthrough there, which has not really traditionally happened once again, and this is what's so exciting about this because it is happening, is large healthcare systems need to make system-wide HIT decisions. Because historically what they've done is they've left it up to all kind of the individual hospitals, and so you get all this fragmentation and none of these systems talk together. And so now all of a sudden you've got social, you've got the cloud, you've got this mobile, is how from a large healthcare system, 200 plus hospitals, how can they come in at the CEO's office and say, we're going to make a system-wide decision on this technology and we're going to get everybody to adopt it so that then we can get it integrated back into workflow. And that's a very recent phenomenon as well, is like they used to always push those decisions down to individual decision makers in local markets. You're starting to see national buys now from an HIT perspective.
And I also just think there hasn't been a place where patients actually are interacting. And I think that part of it is hospitals or insurance companies say, hey, you have to integrate with me and you have to have the data here because there's never been a place where not 6% of people engage, but 96% of people engage. And so once you have that standard where everyone's interacting, there's tons of data, there's tons of usage, it's far easier to export that back into an antiquated old system than it is trying to take an old legacy system and build it into a new era of technology. I think the best example of that is, look at Facebook and what they do with the New York Times. It's a great example. So old school publishing business, all about print, and part of their transition to web was there's a bunch of people on Facebook that can open up our readership and open up our subscriber base. Let's meet them where they are because they're already there. And I think you'll see the same thing with healthcare. Hospitals will start to say, wait, Grant's on this product. How do I link up so that my data syncs seamlessly with that product and then closes that feedback loop? That's what I think will happen.
There is a paradigm shift. I think instead of the doctor will see you now, I see 10 years from now, the patient will see you now. I think the information is going to be so pervasive that I can then schedule who is the best doctor, caregiver to give me the service. And that shift will kind of bring a lot of changes into technology and systems and all that.
Yeah. Doctors, watch out.
My name is Ariel Shalitz. I'm absolutely fascinated by seeing this group of young, brilliant people And while I'm not a Luddite, I'd like to play the devil's advocate. Obviously, the future is in your hands and certainly not in mine. I would like to ask you if you have considered what might be the negative sides or the side effects of what you're into. We are absolutely flooded by data and information is important for knowledge. But information is not knowledge, and knowledge is certainly not wisdom. What happens when, by being set up by 123 devices, I am constantly flooded by information that when my awareness of happiness comes from being monitored back by my heartbeat rather than sensing my own heartbeat? Have you given any thought to the side effects?
Yeah, I'll take the plunge. Absolutely. So I think you said it very well. You know, data and knowledge are very different things. But where technology becomes particularly valuable and useful is when all of that data isn't just there in a whole hodgepodge of information. It's very tailored and recommended exactly to you. We were talking earlier about Amazon. Amazon literally ships things to you or recommends them before you buy them. So Amazon knows if I bought this bottle of water, I'd probably like a case of this water because I've most likely finished it. So if you can create recommendations and feedback so that there's a sea of data, but all that's presented to the end user is a very clean and clear list of things that matter to you and are valuable to you, I think that problem is solved. I mean, what you're talking about is actually what happened with Google Health, in my opinion, and Microsoft Health Vault. They said, hey, put all your data in one place. And the value is all your data is in one place. But they never gave anything back to the user. So you had this sea of data that showed your blood pressure, your heart rate, the prescriptions you took, the doctors you see, and it was just data, and it just was there. What you have to do to break down that, your comments around the downside or the side effects, is you have to take it to the next level around recommendations and value to that user, so that if I give you 10 things to do, that 10 has come from 1 million data points, and I'm not asking you to look through 1 million data points. Because I think what you're seeing with technology is, you made the comments about email. Email has about a 50, 60% open rate, which means if you get an email, 50 or 60% chance you'll open it. Text messages have about an 83% open rate. And so what that means to me is it's very similar. A text is a fraction of an email, right? It's just a piece of it. I think you'll see the same thing with healthcare in terms of all this data. It's not going to be your heart rate, your blood pressure. It's just going to say, hey, here's that one thing I need you to focus on. It's like a tweet. It's 140 characters. And I think you need to be very precise and build the machine learning and the algorithms that take the data and make it very small, very actionable, and it's very precise.
I think his question was also that how do you make sure that the data that's being fed back to you isn't wrong? And how do you make sure it doesn't? I mean, obviously with health, there could be grave consequences.
Just to add to that, I think there's a fiduciary responsibility as a technologist. Like you kind of take an oath that this data, what do you want to design, right? I go back and I say that everything you do, it has to have some context. It's not about big data. It's not about data deluge. It's about big meaning, right? When I go back and see, if I can tell, instead of telling me steps, heart rate, calories, it just tells you, Poonacha, you didn't sleep well last night. Device tells me I only slept for 5 hours, 2 hours deep sleep, 1 hour light sleep, immaterial. It can basically tell me this is what happened around you. Take notice. So if data can give you awareness of something you might not do, then it will help. I actually almost died 2 years ago while climbing in the Himalayas on Mount Kailash. I had HAP. I didn't realize that I was ascending too fast. That's when actually technology can help. But the data can give you meaning, but not, once again, be put in the wrong hands or give you wrong interpretation, right? Yeah. But it's an excellent question. Something we all have to think about as we go along.
And I think that applies for offline as well, the prevalence of medical errors and all this paper and confusion. We always kind of ask ourselves when you talk about social networks, because today we have this thinking about social networks that it's all about scale, right? Everything we talk about, 1 billion users, 850 this, a gazillion of that. But how many people in what we're talking about today do you actually need in your social network to improve your health and wellness? And if you look at offline studies, what it would say is that there's a diminishing return after 9 people. But 5 to 9 is the ultimate number. And there's studies that say if you have that tight 5 to 9 group, people that you really care about and who are dependent on you, then your blood pressure goes down, your stress goes down, your inflammation goes down. I think a challenge like we have is, what does that all mean when we're talking scale? We're talking 150 interactions a day on a phone, and all these APIs that are connecting into platforms and creating all this data. It's who's going to be the support group that helps you manage that are both professional caregivers and people that you care a lot about.
I think we have time for one more question. If there's anyone? I can't, it's hard for me to see.
Kind of along the same vein as the last question, there's some data that comes out that says that kids that are spending too much time on their screens are losing interpersonal skills. And I'm just curious, you made a comment about looking at your iPad to see if you were in a state of bliss. And that was kind of a red flag for me, because I thought in one way it could help increase awareness of my own self. But if I'm a child and I grow up and I'm attached to this electronic device and I'm reliant on a device to tell me if I'm in a state of bliss, doesn't that do the opposite and help me become more disconnected from that awareness?
Let me reframe what I said. That's not exactly what I meant. Was that I can passively look at the camera and see what happened when I was on a device. I can say when I was reading this article, it actually stressed me out. So it's opposite of what I was telling you. So basically, if I know I was on my iPad and reading Facebook and my heart rate went up, that's an indicator to me I shouldn't be doing that. So it's opposite. So I definitely don't want to encourage people to go online. But what I was highlighting is the ability for me to collect information, right? And be able to use it very meaningfully. That when I actually was on my phone and I was really reading this email and my heart rate went up, I can now correlate that email came from my ex-manager, and then, you know what, this person is not good for me. Right now I can actually look at my call logs, and it actually goes back and looks at my heart rate based and my variability based on the calls I've had, right? So I know certain calls were stressful for me. I'm just aware of it now. That's all. But yes.
So I think we'll have to close now. I wanted to actually close by asking all of you to just take 30 seconds, 45 seconds, and share what you think. And a lot of this entire Aspen Spotlight Health is very forward-looking, looking at what's going to happen in 2024 for all of these issues. So let's start with you, Grant. What do you see social networks and health looking like in 10 years?
Making health unbelievably personal. So I think right now, social gets this sort of bad rap that it's very impersonal, and Jeff's comments are terrific. The average person on Facebook's got 500 to 1,000 friends, but if you have 5 to 9 friends, you create an unbelievable amount of connectivity and personal relationship with those people. And I think in healthcare, you begin to translate that into very consumer-focused, very personal-focused health plan design and physician interaction, so that when I'm going to see a doctor and I take my dad with me, we know exactly who we're seeing, they know exactly who they're seeing, and the data flows seamlessly back and forth, and it completes the feedback loop.
So I think the big themes are smartphone, the greatest healing device. Connected care is going to be hugely important, and how we take data plus knowledge to create engagement is how we're going to unlock the keys for personalized medicine. But real quick, to Grant's point, we did this weight loss challenge with Dr. Oz. 1 million people enter it. Gets down. 600,000 people go to Weight Watchers to get weighed in, weighed out. 10 people get down to be finalists. They all lost over 50 pounds. And when you went and you looked at why did those people succeed in losing 50 plus pounds? And what it all came down to was community. And it wasn't the number of people that they were interacting with in their social network. It was the number of interactions that they were getting from that 5 to 9 people. So I think it's going to be important.
Okay, so I was just thinking as you were speaking. So I think when I look forward 10 years from now, I see a social network for health which is unbounded positivity. I think we need to have a network which is, when you get into a social network, I feel positive. 2, it should basically empower the individual with knowledge and help me with behavioral changes and make it affordable to everybody, right? From North America all the way to Africa. And at the end of the day, it's about improving your personal health and community health. So basically, we have a more sustainable planet, and that's the vision.
Thank you all so much for being here. Our esteemed panelists, a round of applause. Thank you.
Thank you for moderating.